ẹ̀yin èèyàn mi ẹ jẹ́ kí n sáré fún yín ní àwọn ìdí mélòó kan tó fi jẹ́ pé tá a bá jẹ́ ẹni tí ó lóyún after the age of 35 years ó yẹ ká mọ̀ pé oyún tó gbẹgẹ́ ni. What I'm saying in essence is whenever you are older than 35 years and you are pregnant, you should know that your pregnancy is high risk. What that means is that kí èèyàn máa fi ojú ìgbà tí èèyàn kéré wò ó sí ìgbà tí èèyàn wà lásìkò yẹn. O lè ti ní àwọn oyún kan tó fi jẹ́ pé kò sí problem pẹ̀lú ẹ̀, ṣùgbọ́n gbàrà tí o bá ti wọ 35 years wàá mọ̀ pé o ti bọ́ sí position high risk nínú oyún. Ẹ jẹ́ kí n mú àwọn àpẹẹrẹ mélòó kan wá tó fi lè jẹ́ kí a classify women older than 35 years in pregnancy as high risk. Ẹ jẹ́ ká bẹ̀rẹ̀ láti lóyún yẹn gan. Now láti lóyún fún ẹni tó bá ti ju 35 years lọ kò rọrùn bí ìgbà tí èèyàn bá younger than that. So ó súnmọ́ pé kó jẹ́ pé oyún yẹn gan o ti gbìyànjú lórí ẹ̀kọ́ tó ní, àbí kó tiẹ̀ wá jẹ́ pé wọ́n padà lo assisted reproduction láti rí pé oyún yẹn dúró. By the virtue of this alone ó ti place yẹn sí pé oyún yẹn ó ti di ẹlẹgẹ́. Nǹkan kejì ni wípé oyún yẹn ó jẹ́ oyún tó lè easily bàjẹ́ tá a bá compare mọ́ younger age group. Látara pé ẹyin at this time the egg qualities are usually not as good as before. In fact, the remaining egg at this time they don't have good quality as before. They are prone to miscarriages. So olófìfà tó fi jẹ́ pé ẹni tí ò ní miscarriages rí nígbà tó kéré after this age ó lè lóyún ó ní early pregnancy failure àtàwọn miscarriages bẹ́yẹn. Now apart from this gan, the possibility of still carrying this pregnancy tó dẹ̀ jẹ́ pé on a good day abnormal pregnancy ni ó wà. Gbogbo wa la mọ̀ pé most of the time if you have met a doctor before you have had a miscarriage wọ́n máa sọ fún wa pé miscarriage ó jẹ́ nǹkan tó máa ń ṣẹlẹ̀ ní ìgbà tí bóyá quality ẹyin yẹn ò dáa, chromosomal problems. In fact 50% of miscarriages tí èèyàn bá ní chromosomal problem might be the reason. So sometimes this chromosomal problem could just escape. So that's why at the age of 35 and above you are at risk of having anomalies, chromosomal problems like Down syndrome and co. So we should know that. That's why when you are pregnant at this time, you should register your pregnancy in good facilities. Now, another reason is that even while pregnant, you are at risk of some medical conditions. Maybe by the virtue of your age, you even had the condition before pregnancy. Things like diabetes, things like hypertension. Ó lè ti wà lára èèyàn kí èèyàn ti máa lògùn diabetes, kí èèyàn ti máa lògùn hypertension. Tó dẹ̀ yẹ pé some of these drugs gan lásán ó lè fà á kí oyún yẹn kó bàjẹ́, ó lè fà á kí àwọn ọmọ yẹn kó máa wà normal. So ó máa jẹ́ ká mọ̀ pé at this age the risk of kí hypertension go ṣẹ̀ṣẹ̀ bẹ̀rẹ̀ ó wà, and this hypertension could end up becoming like eclampsia, preeclampsia and co, increasing the chances of dying or coming down with morbidities in pregnancy. Now another thing is that even sometimes these medical conditions alone could put you in the risk of some operative deliveries. You have hypertension, perhaps you are obese, they might want to consider you maybe for surgery or some other operative delivery. Even your pregnancy might not even come to delivery by itself. I mean, tí o bá jẹ́ the age of 35 and above and you are getting pregnant, pregnancy might not want to come to an end easily. O lè need induction of labour. Induction of labour could fail. O lè mean wípé you have prolonged labour. Prolonged labour, prolonged pregnancy, all of this could bring about even stillbirth. You are at risk of stillbirth, apart from structural abnormalities and co. In fact, oríṣi àwọn nǹkan míì tó tún lè ṣẹlẹ̀ tí wọ́n bá ti ju age of 35 kí wọ́n tó máa lóyún. Ó include pé bóyá pé rupture of membrane ó lè ṣẹlẹ̀, omi akọ̀dédé drain, labour ó lè set up even before the 9 months, the so-called term, you understand, preterm labour. All of these things, maybe by the virtue of the medical conditions that you have or the virtue of even your age itself, ó lè ṣẹlẹ̀. Then another thing is the placenta problems. For example, now, if you have had pregnancies in the past and now you have another one, placentas in pregnancies, wọ́n máa ń fẹ́ ṣe nǹkan tó fi jẹ́ pé ibi tó bá wà virgin wọ́n máa fẹ́ implant sí. For example, àwọn placentas yẹn wọ́n ò ní fẹ́ lọ síbi tó ti wà tẹ́lẹ̀ rí bí àgbà tó bí àkọ́bí tó bí ẹlẹ́kejì. So sometimes you are at risk of having abruption placenta, normally situated placenta, people separate even before the delivery of the baby. You are at risk of having placenta previa, which means the placenta lying low or even coming in front, close to the cervix, coming in front of the baby. It's a risk when you are older than 35. So what all these things means is that you are high risk. You need to know. Pregnancies are not the same. And the fact that you have had pregnancies in the past, to get any problem, you should also have it at the back of your mind that age is a singular factor that is constant. So you have to know that. Register. In fact, preferably, you should undergo a medical treatment in preconceptional care. In preconceptional care, you have to let your doctor know that, doctor, I'm trying to get pregnant. What are the things that you should do before this pregnancy? They will need to review your drugs. Perhaps you have been on antihypertensives, one in lati wo, antidiabetic, even the dose of your folic acid, one in lati adjust appropriately, one in lati share test of one check on blood sugar, one check on every other thing to know if this pregnancy that you are trying to have will be safe for you. So I want to take your money. Then beyond the preconceptional care, when you get pregnant immediately, you have to register on time. When your time to get when you have to work before 4 months, 5 months, go to the register. Why? Because some of these chromosomal problems, you can actually pick them very early in pregnancy. And when you pick them, you might have the opportunity to even correct some of them or even know the diagnosis earlier. You'll be able to cope mentally, psychologically, even financially. And some of them might even call for termination of the pregnancy. So these are reasons. So you have preconceptional care, you register your pregnancy as early as possible, you do your scan as at when due, and also you have to be on folic acid prior to pregnancy. Adjust your drug as appropriate. All these antihypertensive, some of them are not even safe in pregnancy. You might be hypertensive, you can't use the medications you have been using, and you will just get pregnant like that. Then besides, later on in pregnancy, when you are in labor, you can't expect your labor sometimes to move as smooth as in the past. For example, now, maybe in the past, you have always had smooth pregnancy, smooth delivery, smooth labor. It might not occur when you are older, because the uterine contraction will not smoothly. Then besides, your response to drug may be erratic. Precipitate labor no le ṣẹlẹ̀, ìwọ tó ti ń ṣe bọ̀ tó ti ń bímọ, labor yẹn kò lè set in within a short time, and you will be like, o ti fẹ́ máa gbé, o ti fẹ́ máa labor, o ti fẹ́ máa deliver. You understand? These are few reasons to let us know that whenever we are older than 35 years, our pregnancies are high risk. So what should we do? Preconceptional care, register in very good centers, and attend your clinic as at appropriate. I wish us the very best.